Okay. Hello, today we're going to be addressing SDG 11, Sustainable Cities and Communities, introducing Solaride. Meet the team. My name's Tara. I'm here with Charlotte, Sam, Wyatt, and Will. What we're going to cover, first we're going to be covering our SDG, which is 11, Sustainable Cities and Communities. The problem at hand, which is rural areas and their disconnect due to lack of transportation. And the structure of this presentation is going to be walking the audience through mobility challenges, deployment plan, revenue, and next steps. Our SDG focuses on making cities and human settlements inclusive, safe, resilient, and sustainable. The problem addressed is the severe lack of safe, reliable, and sustainable transportation in rural Nigerian communities. This lack of transportation restricts access to healthcare, education, and economic possibilities while also providing the perfect environment to foster poverty and social isolation.
So now I'm getting into some of the context into why we chose this SDG. Um, there's been rapid urbanization across the globe. Over 55% of the world's population now live in urban areas. This puts enormous pressure on housing, infrastructure, jobs, and the environment in both cities and the surrounding rural areas. This urbanization also leads to a lack of access to transportation. Globally, only 1 in 2 urban residents have convenient access to public transportation, and the numbers are even lower in rural areas. Metropolitan areas drive economic growth. Making them more resilient, inclusive, and efficient creates jobs and reduces poverty. Sustainable planning can increase health and well-being and reduce pollution as well as traffic deaths. So our target market that we're focusing on is rural families in Nigeria. So why do we pick this target market? Why Nigeria? Well, there's a high rural population with limited access. In fact, over 47% of Nigeria's population lives in rural areas. Many families lack access to reliable transportation, making it hard to reach healthcare, schools, and job markets. Existing transport is unreliable, unsafe, and not eco-friendly. Women, children, and the elderly often face mobility obstacles.
And now we move into our customer insights, and we chose rural families in Nigeria. And we chose to focus our segment on rural families in Nigeria with the help of the Adams criteria. Accessible, they were harder to reach due to dispersed locations and infrastructure gaps, yet reachable via community networks and local media. Differentiable, there were clear needs like job access, education, and health, and role-specific behaviors. Actionable, there are programs that we could use and government NGO support to gather and allocate resources to improve public transport. Measurable, it can be estimated via census or agriculture data, but it varies by region. And substantial, with a large population, Nigeria faces an extremely significant lack of access to public transport. And some key characteristics of our chosen persona of Amina. She's a 27-year-old single mother. She resides in a poor area of rural Iko, Nigeria. Her socioeconomic status is low income, which makes it very difficult for her to provide for her family. She lives with her 3 children, grandparents, and other extended family in one home. And she graduated from secondary education, and her children are currently in primary education. And Amina also has several needs which we can help her meet with our solution. Some of those needs are improved and more efficient access to transportation, which can help lift a burden off her chest of having to walk everywhere. Basic education for her children, which would result in better educated children in the future. Quality medical care for her mother with her various health needs, and higher income to support herself and her family, such as more food and clothing.
Now that you know more about our SDG and target market, I would like to introduce our solution, Solaride. Solaride is a community mode of public transportation designed to increase the quantity the quality of life for families in rural Nigeria. Solaride is a large bus with a boxy base made out of steel to ensure ultimate safety. It is also equipped with a large all-terrain wheel to accommodate the poor infrastructure and roads. There's a built-in ramp to accommodate all passengers, especially elders that need to go to the hospital, such as Amina's mother. In the interior of the bus, the seats are foldable to accommodate luggage and larger essentials people might need. Solaride is powered by a combination of solar power and biofuel for extra security. For example, if there's a long stretch of bad weather or little sun, the biofuel will still keep Solaride running in a sustainable manner. Solaride runs on a need basis for people in the village by calling a number that adds stops to the route. The major stops for this bus are essential places such as school, job centers, grocery stores, hospitals, and other healthcare clinics, as well as larger transportation hubs. With the tagline being Solaride, your road to health, happiness, and opportunity, we plan to connect with our audience through an emotional appeal by using real-life struggles that our audience can relate to, allowing them to feel seen, understood, and more likely to use Solaride as a resource. The solution of Solaride creates a lasting impact of opportunity by making sure kids have an accessible way to get to school, increasing school attendance. It allows more access to healthcare, which increases the quality of life as well as mortality rates. Additionally, it cuts down walking time, creating more time and opportunity for mothers like Amina to work, make money, and support her family. Beyond individual families, the bus system creates jobs for people in the village, increasing overall economic growth in the community. Lastly, it is a way to bring the community together as a whole and increase overall well-being.
Okay, so now I'm going to talk about our customer journey. It first starts with recognizing the problem that the public has limited access to sustainable public transportation. This results in a lack of opportunity, social exclusion, and increased economic inequalities. Next, our action is taken to introduce Solaride, and this is shared to the community through a few different channels. Now, members of the community in rural areas with low income will have access to affordable transportation to school or work. With Solaride within the community, there's a greater access to jobs and education, there's increased economic growth, and there is urban to rural connectivity. For our revenue model, we decided to choose both a fare-based and subscription-based model. Both these types of models will be very affordable for the poor population, and since not all riders are the same, frequent and infrequent riders can choose between each model. Now, with it being affordable and accessible, there will be increased access to sustainable transportation, which directly aligns with our SDG 11. For our pricing strategy factors, we have four main costs, which are vehicle manufacturing, solar panel technology, driver salaries, and bus maintenance. Our customer characteristics are low and unreliable income, variable income, such as like street vendors, and with this low income, our people usually only spend money for buying necessities. The channels we choose to introduce Solaride are community engagement and word-to-mouth demo days with the bus in person, bright and obvious visual marketing with the use of posters, and recognition from local community leaders. The competition that Solaride faces are shared vans or minibuses. These can be often expensive for the typical rider. Privately owned cars, which are rare in Nigeria and very expensive, and tricycle motorbikes. These are inefficient, have an expensive initial costs, and very high maintenance costs.
Today, we've shown how thousands of rural Nigerian families are cut off from schools, hospitals, and jobs simply because reliable transportation doesn't exist. Solaride is more than a mode of transportation. It's a bridge to education, a lifeline to healthcare, and a launchpad for local economies. By combining sustainable technology, community-driven design, and deep on-the-ground insight, we're turning SDG 11 into a reality. Join us in powering the journey forward. Access to schools, hospitals, and jobs shouldn't depend on where you live. Our solar-powered community bus is connecting rural families to opportunity cleanly, safely, and affordably. Be part of the movement. Support, ride, share, build. Together, we're driving towards a brighter future. Visit our website or take a brochure to learn more. Thank you for listening.